Well, good morning. My name's Terry Rudd. This is Holly, who's going to be my patient today. I would like to demonstrate some tricks on how to take a blood pressure because it can be very challenging to take a blood pressure. And doing a good, accurate blood pressure is essential because sometimes the electronic equipment doesn't work, and there are settings where you're going to need to take a manual blood pressure. Now, first of all, it's a good idea to have a decent stethoscope. A decent stethoscope has short, thick tubing, and the nice thing with this stethoscope is it has a diaphragm and a bell. The nice thing about having a bell on your stethoscope is if you have difficulty hearing the blood pressure, you can always use your bell. Okay, you can always use the bell. With the stethoscope, you want the earpieces facing ever so slightly away from you because that's how your anatomy is. With stethoscopes, you never know who used it before you or where it's been sitting. So, of course, you want to clean your earpieces, yes?
Yes.
Okay. My name's Terry. I'm going to be working with you. I'm going to take your blood pressure.
Okay.
And you don't say, can I take your blood pressure? You say, I'm going to. And if they don't say no, that's implied consent. Okay? Now, the first thing I'm going to do is I'm going to be showing persons how to take a blood pressure. The first thing you want to do is palpate a brachial artery. The brachial artery is always on the inside. And if you have the person slightly hyperextend their arm, it's going to be better to find it, okay? And the reason you want to palpate the brachial artery is that's exactly where your stethoscope is going to go, okay? And you have a nice strong one.
Thank you.
Thank you. Now, in getting your blood pressure cuff set up, it's essential that you use the right size for the individual. If you use a blood pressure cuff that's too small for the arm, you're going to get a false high. If you use a blood pressure cuff that's too large, you're going to get a false low. For me, in the past, I've always had people use a large cuff on me. I've lost like a lot of weight. And I would never let anybody take a blood pressure on me with a normal cuff because I didn't want a false high on my record. Okay? So I'm going to take the cuff, and this happens to be your right arm, and this particular cuff has a spot that says right arm, and it has an arrow pointing to exactly where that brachial artery is. You see how that goes? So this particular cuff has a device where I can actually put the meter there. Keep in mind, you cannot hear the pulse with the cuff not pumped up. You with me? Some people think they can put this here and hear the pulse. You can't. You can't. What does your blood pressure usually run?
I think it's like 120. I think it's a little low actually.
Okay.
Like 110 over 70.
So if Holly's telling me her blood pressure is like 110 over 70, I'm going to pump up 20 or 30 more above it. Okay? Because what's going to happen when I take this blood pressure, I need to have a period where I hear shh, and then boom, 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 boom. The first sound is the systolic. When it goes away, that's the diastolic. If I don't hear a silent period before, I didn't pump up high enough. Now here's the trick. You always close the valve to the tubing. However you hold this, you always close the valve to the tubing, and I recommend you close it gently, because if you close it too tight, you're going to be fiddling to open it up. So I'm gently going to close it to the tubing. I'm going to make sure my stethoscope is on the right side, because if it's turned the other way, not the right side. Okay? Here we go. I'm going to put it here. Some people say you can't put your thumb here, but if it's turned correctly, you can put your thumb there. It's closed off. Got it? So what I'm going to do is pump up to about 150, and then I'm going to let it go ever so slightly. and it's going to come down on its own. Boom, 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 boom. I got 122 over 82. You always state on a manual BP in even numbers. Okay? So I had a period of silence. I got 122 over 82. But did you see what I was saying by letting it go gently, and then it'll come down all on its own and you don't need to fiddle? The normal ranges are generally 90 over 60 to 140 over 90 for adults. However, some sources will say anything over 120 over 80 is considered pre-hypertension. Thank you so much.